Good morning. Welcome to City Corner. We've got a lot of great information today to talk to you about Project Search and At Home Care, a wonderful organization. Also, the wonderful things that St. Louis has going on. You come on back. And welcome to City Corner. I'm Robin Boyce, and in the studios with me this morning is Miss Jackie Jefferson, who is a program manager for a wonderful program called Project Search. And I did not know that this was an Easter Seal program.
Exactly, yes. Easter Seals has been in the community for over 50 years.
For a long time.
Very long time. Our specialty is working with persons with disabilities in the community to help them live, work, and play in society as well.
I think it's wonderful. I have had an opportunity to work with some of the young people, young adults that you all help to get into corporate jobs or government jobs. It's wonderful, the opportunities that young people with disabilities, and there's no reason for any child out there, I could see from this program,
Absolutely.
to get work, be very happy about what they're doing, and take instructions and do a great job. Tell us a little bit more about Project Search.
Right. Well, Project Search is an internationally recognized program. We actually focus on helping individuals with disability build and gain work skills to actually go out into the society and get a competitive job. So we've been doing this now for about 7 years. We partner with host sites. Currently we have 4 host sites. We are partnered with the City of St. Louis and Slate.
Yes.
And that is where you were able to experience Project Search. We also are partnered with NBC Suites in St. Charles, Centene Corporation, and the VA St. Louis healthcare system.
That's excellent.
Yes.
So all of these different organizations, governmental and private, have opened the doors to individuals who need work skills.
Absolutely. They are fabulous partners. Not only are they partners, we have like missions. They have programs that are featured and really focus on persons with disabilities in their disability inclusion awareness programs. We do too. We're excited about that mission. We're constantly out on the move in the community looking for other partners as well. It just doesn't stop at 4. So.
Yeah, it doesn't stop at 4. Was this the first time that you came on board with Slate in the City of St. Louis? Was this the first time the organization came in the door?
Yes, this was the very first time. We actually branched out, talked to the City of St. Louis and Slate. Of course, Slate is embedded into the community in the city. And again, we're looking to place individuals with disabilities in competitive roles within the city and throughout the City of St. Louis. The partnership with Slate just made a lot of sense because our missions aligned. They turn out about 1,000 jobs a week, and we are looking for jobs, so it just made a lot of sense.
That is beautiful. Now, tell us what takes place if a person is looking at this program, a caregiver or a parent of a disabled young person is looking at this program. What are the first steps for them to get their young person into Project Search?
Well, the first step will be, of course, to contact Easter Seals. Easter Seals is the only service provider in this region that partners with Project Search. Once they come in contact with us, they would probably talk to me. We actually do eligibility requirement. It's an application-based program. They would fill out the application. We will evaluate the application and then accept the person into the actual program. We would pair the person up with the program that's probably close to them for our city residents as well as our county residents as well. There is a slight assessment done on the individuals, just wanting to understand, are they able to follow directions, just some basic skill components that we're looking for as we try to immerse them into those actual businesses.
So these individuals don't have to have had gone through a program or something that would have to give you all a referral or what have you.
No.
Like a lot of programs require that they come from a program that they went through or something like that.
They don't have to have any type of program or job-related experience. A lot of our individuals do have some volunteer experience that's really great, but one of the criteria is that they are paired with one of our stakeholders and or funders, which would be Folk Rehabilitation, the Disability Development Board, the Disability Development Board Resource Board for St.
Yes.
Charles,
Yes.
as well as the St. Louis Regional Center. So all of those organizations, they should probably be paired with one of those organizations. And most of the time, our individuals that have come aboard, they have touched one of those organizations at some time and point in their lives.
Now, do you have to go out and recruit these young people then, or is that what your job is, like to sit at a jobs fair and to let people know, or to go in environments where there are disabled individuals that you know of to recruit individuals in?
Yes, it is. That's one of my part of my main role of what I do, coming in contact with individuals like you, promoting the program on segments like this as well. But as they also come in through those regional centers and partners that we have, they come in through Voc Rehab, they come in through walk-ins, they come in through referrals. So it's multiple sources in which they come into our program. So
tell us a little bit about some of the other things that Project Search also does within the Easter Seals, and what some of the other great programs that Easter Seals has been able to outreach into the community and do.
Well, along with Project Search, Easter Seals has been working with persons with disabilities on a number of capacities. We have an autism department. We have a community connections department as well. Our community connections is really focused on getting persons out in the community with higher needs. They can also work as well.
Exactly.
So we take them out into the community. We, again, partner with different organizations to help them build their skills as well. So with the
I always
possibility of
remember the Easter
employment.
Seals as taking care of disabled young people who could not walk or were wheelchair bound, and I just, and I hadn't heard anything about Easter Seals in a while until Project Search came through, and it was like, wow, what is Project Search? And then Easter Seals, I'm like, what is Easter Seals doing? So it's Easter Seals Midwest.
Easter Seals Midwest.
Okay.
Easter Seals Midwest. So we're located throughout the state.
Okay.
Just Easter Seals Midwest. We decided to partner with Project Search here in our local community. We felt that it was a need to make sure that individuals with disability have the same rights, the same opportunities as everybody else. If we would look at some of the statistics from the Department of Labor, individuals that do not have a disability, their employment rate is at 70% versus persons without a disability. We're looking at about a 30% employment rate.
So you're seeing a lot of, and that's due to what trainings that they might be getting at the rehab centers or some of the learning centers before they get to you, or what is the Labor Department seeing?
Well, what we're seeing is, or what the Labor Department is seeing is, and what we are actually seeing is that persons with disabilities, there's a stereotype about working with persons with
Let's
disabilities.
work with that, yeah.
About what their capabilities are, what they can't. Most of the time, people focus on what they can't do opposed to what they can do. And what I have often said, I've spent a lot of money on education. I've come into some contact with persons with disabilities. I will never be as smart as them. All the money that I've spent, all the skills they have, they are just as talented. They have skills, and it's just a matter of working with them in a different manner.
When you go out to recruit businesses, for example, to take on some of the young people that you all work with, what are some of the misnomers and or stereotypes that they have when you sit down in these conversations with some of the CEOs and managers of these companies?
Well, first of all, just getting into the door to have the conversation can be a challenge. Again, there's some misnomers that they cannot do the job. The first foremost, they will become a liability to them. And so what I often do is actually point out to an organization the actually return on what their investment could be working with these individuals. There are studies that determine and say that these individuals are more reliable, they're more dependable, and they do bring certain skill sets that are needed in the workforce.
So it's basically almost like a sales job.
It is.
And you're going in and actually selling individuals who can do the job to individuals who have opportunity for them to learn then.
Absolutely. And it's also a way to reach out to companies that are working on their inclusionary efforts, showing them how to connect that inclusion to this particular population, showing them that this is an experience, because a lot of the companies and a lot of people that I deal with within the companies, they have no experience with a person with a disability. And so
that's what,
exposing
yeah,
them
right.
to that experience with a person with a disability and letting them know and shining on what could be their return on investment as well.
When you say that to them, do their eyes light up and they go, let me look at that, because this sounds like these might be much more reliable employees.
Absolutely.
And that these are people that we could count on to be on time,
Yes.
to get there. Because my experience with folks from the project search is just professionalism,
Yes.
feeling very happy about being there every day, very courteous, and getting the job done.
Getting the job done. You know, they're in for the long haul. They want to be contributors and have the opportunity to contribute to society as well. And so Project Search, along with these particular companies, Lambert, St. Louis, that's where we crossed our
Yes,
paths.
at the airport, yeah.
Right at the airport, the City of St. Louis Slate, all of those companies give us the opportunity to do that. And we're very, very fortunate and very, very thankful as well.
What are some of the things that you do to encourage the young adults that you bring on board with reference to outside activities from work and or graduations, or something to kind of give them a thumbs up, or a just an applaud for going through the program?
We have a multitude of things. One of the things that we really do is we really immerse them into the culture. I think, Robin, as you saw while we were there at Lambert, they have the same dress code. You know, they have an onboarding experience. They're working one-on-one with a manager and or mentor.
Yes.
They're experiencing informational interviews, getting to talk to individuals, exploration, exploring their interest in a particular job. In the one department that we're in was the finance and accounting department. We paired an intern that has a very strong numerical background with the Department of Finance and Accounting, and it was really a great experience for that individual.
And that individual, you all had a big ceremony, I understand, along with Slate, and how did that go?
Oh, we were so
Because he was so excited. He wanted me to come, and I was like, Eddie, I can't make it, but we've got the information up right now about your program. But he was so excited, and it was a delight working with him. I did not work directly with him, but it was great having them there. And you all had a great ceremony for them down at Slate.
We did.
And,
we did.
That should have made them feel good.
It did. They were excited. You know, the closer we got to, the time for a ceremony, they were talking about
Oh
the
my
ceremony.
God, he was so excited, yes.
Absolutely, because the program runs about a year.
Okay.
So it's a year of skill building training. And for employers, this is perfect. What we're hearing is that people want longer programs with longer skill building training opportunities, and we're doing just that. So at
You're
the
doing a great
end,
job.
You start off with individuals, peeking and finding out about their interests.
Yes.
At the end, we're celebrating and happy and crying as
Jackie,
well.
Jackie, you're doing an excellent job, and so
Thank you.
is Project Search with East of Seals. I thank you so much for coming on. Love to have
Thank
you back
you.
on with another
We'll
group
come
of
right
panel
on
of folks
back.
to talk about employment in the community.
We will.
I appreciate you for coming on and letting us know.
Thank you,
so
Robin.
much. Thank you. Thank you so
Alrighty.
much. We have a whole lot more great information coming up. You want to understand a little bit more about Medicaid and Medicare and how it may affect you and or your loved one. Come on back.
Listen now, can you hear the bluebirds? Oh, look up now, can you feel the sun? Whoa, whoa, whoa. Can you feel the sun?
everybody. Back in the studio. Hi, I'm Robin Boyce for City Corner, and with me right now is Ms. Carlita Vassar, who is the CEO and Director of Nursing for At Home Care. Hello, Ms. Carlita.
Hello.
I'm
how
so
are you?
glad you could come in and talk with us today about Medicaid and Medicare and what's going on right now. That's a huge issue, especially for the boomer population or demographic that either finds themselves going into needing at-home care, dealing with Medicare, dealing with Medicaid, and or they're taking care of somebody having to deal with all those elements. What's the news at this point? What's happening that we need to know about?
Well, there have been cuts again. Last year, at the beginning of the fiscal year, most of the home care providers were kind of aware that the cuts were coming. We didn't know how drastic the cuts were coming. So that was the first cut. And then even if this fiscal year, there were more cuts that just happened as of July the 1st within Medicaid. The state of Missouri has been undergoing a lot of changes.
Yes.
Especially within healthcare.
Yes.
It's not even just a state problem, it's a global issue.
It really is.
The healthcare costs are tremendous. One of the interesting things is, oddly, even with all the budget cuts this year, we thought, meaning the state of Missouri, thought we would have an extra amount of money, about $200 million, that would be able to be allocated back into the budget for seniors, back into the budgets for the children, back into the budget for higher education, back into the budget for the pediatrics that lost a lot of their coverage and care. However, they still rolled around with the budget cuts. So individuals, for example, and we provide multiple services.
Right.
And one of the services that's very popular
Yes.
is the consumer-directed service. One interesting thing is the units, which is 15 minutes. So each participant that had more than 511 units lost about 5 hours a month just as of July the 1st.
So when you say units, this is kind of like credits towards paying.
Well, 15 minutes that's how they count it. So every 15 minutes is considered a unit. So each person lost approximately like 5 hours, 5.5 hours a month in care.
Okay, and explain to the audience when you say units with reference to what it is you do in patient care. Yeah.
So at-home care provides services to disabled adults and senior citizens. We cover about 40 counties in the state of Missouri now. One of the programs that we cover, provide services for is considered home and community-based services.
Right.
That there are two programs. There's in-home, which is personal care, homemaker, chore worker, respite services, and nursing care. The other program is the one that you see the billboards everywhere. Get paid taking care of your loved one.
Right. Okay.
And so that's not really a fad. It's been going on for a long
Yes.
time. And it's a great program. The problem that we have in Missouri is Medicaid is a big portion of our budget.
Okay.
And so when it comes to budget cuts, most of the time it seems like it's on the backs of our seniors.
Wow.
And yeah.
That's a little scary. Now, you said Medicaid, one of the magic terms that a lot of folks who are looking at retirement right now really need to concern themselves with the differences between, because a lot of folks are still confused with Medicaid and Medicare. Explain those two, define what those are first as we go into this conversation.
Well, I'll talk about Medicaid first. Well, Medicaid is the insurance of last resort. It is an income-based insurance, disabled as well. So if you are disabled and you have a low income, around $875 a month.
Excuse me?
Yes. Oh, wait, it gets better. You're allowed a $20 cost of living allowance, so around $895 a month. You are making too much for Medicaid. Now you'll
Wait a
hear.
minute. Okay, say this again. Please listen. Please, y'all. Listen.
So if you make more than unemployment, even unemployment is too much technically, because most people get around $320 a week. Now, you cannot qualify for Medicaid. But as I said, Medicaid is also for disabled. So it's not like you can just get Medicaid even if you have a low income.
Okay.
You must have a disability attached to it.
Wow.
Or have children. And then it's a different program that you can.
Medicare is then what?
The Medicare, there are 4 parts of Medicare, so I'll talk about them real quick. Part A is for disabled disabled or seniors, it's free, no extra cost. It covers hospital, hospice, home health at 100%, 80% for hospitalization, 20% out of your pocket.
Okay.
Part B is the part that you can pay for. Once you're at a certain point, I think it's like a 2 years on disability, or you get to the Social Security age, you're eligible for Part B, and that covers your medical care.
Gotcha.
Still, you have 20% out your pocket.
Okay.
Then I'm going to jump to the Part D. Part D is the prescription plan.
Oh, yeah.
So you'll hear a lot of people say, I have a prescription plan through this company, and they'll have Medicare Part A and just a prescription plan. It's really a choice factor on what portion of the Medicare program you want to utilize. And then there's the C, which you'll hear a lot about, which is an all-inclusive, where it covers A, B, and D all
And that is
together.
amount that individual, if they decide to go with the C on Medicare, have to pay for out of their pocket too?
Yes, they pay either for they can either pay for one of the three, they're paying out of their pocket.
Oh, really? So
Yeah.
they still have to. When are we ever going to get to free health care in this country?
It needs to hurry
Can
up.
that happen, or is it just totally impossible because of pharmaceutical companies, medicine, the way folks have in this country and with capitalism have been able to make money off of it? Is that what's keeping the United States of America from actually doing what other countries are doing, like Canada and Cuba and England? Why aren't we there?
Fear.
Fear of what?
Fear of change. The fear of loss. A lot of pharmaceuticals companies will not be able to make the same amount of money that they make. Fear of improvement. Sometimes, not knowing the outcome. It's not that we can't do it. I don't even think it's a wanna do.
Okay, because we have precedent that it's happened, that it's been successful. I mean, I don't see Canada screaming we're broke or we're in bankruptcy or any of the other countries like, over in Europe that offer it. I mean, you can even fly into some of these countries and immediately you have free
healthcare.
Medicare if something happens to you on your vacation or on your trip.
Right.
So, so how, so is it going to take the people of the United States of America who live in all across the country in these different congressional districts, senatorial districts, to really help make that change? Is that
We
what
have to use our voices, and to do that, we have to vote. We have to be present in all elections, not just the federal elections, or you have to be present in your local elections.
to make a big difference?
And also be present in town hall meetings and conversations like this, and have the conversations at your Sunday dinner. We don't talk about health issues. I'll tell you an interesting story. I was sitting talking to somebody one day, a family member, and they started talking about they had to take their blood pressure pill. I'm like, they had high blood pressure for 10 years. I never knew that. And so we need to have that conversation in our own households about our health, our desires for the future, what are our plans for the future. And that's also a big problem because we don't plan. As a provider of home care, I see people in crisis mode a lot. They're trying
That's
to
probably when you get the call, isn't it?
Yeah, they're panicking because their job is sick of them taking off work all the time. They're about ready to get fired from their job because they have no one to take care of their mom or dad. Or, I've had calls from somebody out of town, please just go by, check on my mom. She's not answering her phone. There was nothing wrong with her. She just didn't want to answer her phone. But you don't know that.
Right.
You don't
Right.
know. And so we are all, if we look, we are all in the same boat. It's not even an if, it's a when. When will we get to the point where we're having to take care of our family members? When will we get to the point where somebody's going to have to take care of us?
Right, and it happens, and that's the scary part that a lot of people don't do. Like you said, we're not talking enough about planning for the possibilities of having to deal with Medicaid, having to deal with Medicare. We need to understand specifically how those two entities break down and how they affect what happens in the community if a person can't get it. And on a state level, what are some of the things that constituency can do when it comes to the state reps that we have there and the state senators?
Hold them accountable, and don't wait till election day to decide who to vote for. looking at the name of a person, voting male or female.
Sure.
Know what's in it for you, not just for you, for your children, for your grandchildren. They're the ones who are going to have to make the decision about whether or not they keep you at home and put you in a nursing home. Most people,
Yes.
There are a lot of people in a nursing home that really don't need to be there. Have you, if
Wow.
you've ever,
See, now that's see.
they don't
Okay.
need to be there because they don't have anyone to take care of their medicine or make a meal. But if somebody was checking in on them all the time, grabbing their meal, doing what I call essential correspondence, making sure the gas bill gets paid, they would do well in their own home.
Yeah, they would be. That's one of the reasons why we did not move mom and dad into facilities. They wanted to be in their home that they raised us all in. And I'm really grateful that we did that. I mean, it was hard when we were into the throes of making sure we got this done, that done, yada, yada, yada. But in the end, that was a good thing. It was healthier for them.
We have to spend time, and I'm in my 40s. We have to spend time on talking to an estate planner, knowing what your assets are, because like I said, Medicaid's an income-based insurance. So if you do not have an appropriate amount of money,
Which
you won't
we
be able
didn't know until we started taking care of mom and dad. It was like, really?
And Medicare doesn't pay for a
They
nursing
didn't.
home.
They weren't qualified for. I'm like, well, their retirements were great, but
It's
oh
not
my
enough.
God, it's still not enough. You still having to rob Peter to pay Paul. But I want to tell you something. You are just wonderful coming in here with this information. I'd love to have you back.
Okay.
To continue with. Especially how important it is for people to plan toward this. There should be some mechanisms that are in place that make it happen so that people understand. I mean, and I'm sure that when you meet folks initially, that's probably what they haven't done, is planned it.
And then the sad part is what I call my gaps, where they make too much money for Medicaid and they don't have enough money to even afford a nursing home.
Okay, that is scary. That's scary because as we found out, nursing homes cost quite a bit of money.
$6,000 to $7,000 a month.
Yes, and who has that kind of retirement? And if they do, they want to use it on whatever it is they're doing in their environment. People need to pay attention and do a lot more planning than they do.
Yes, they do.
And we've got to, I guess, really start screaming at the top of our voices and are becoming these advocates for seniors. And I don't know if we have, and I don't think we do, have a person who will do that or is there to do that, but we've got to get out there.
Oh, there are.
There are.
There are some silent voices and there are some loud voices out there.
Okay.
We campaigned and protested and
Yep.
fought for about a year about the budget cuts for last year.
Sure, and I'm sure that's going to continue on. Thank
it's
you so
gonna
much.
continue on.
I got to get you back on here so we can talk more about it.
Okay.
Thank you for coming on. I
Thank you
appreciate
for
it.
having me.
And thank you for tuning in to City Corner. We'll see you next time for another good episode. Bye-bye.